On slide 90, we look at the hook of the hamate fracture. This is very important to pick up. Usually the mechanism of injury is a fall on a dorsiflex wrist on the ulnar side of the hand. Patient may present with pain either on the volar or the dorsal side of the wrist. We have to look for associated problems. When we see the axial view on the CAT scan on slide 90, where the red arrow is, we see a fracture of the hook of the hamate. These fractures may appear at the tip of the hamate or at the base. The anatomy is very important. The flexor digitorum profundus tendons to the ring and small finger come right across this particular area at the base. The ulnar nerve also comes around the hook of the hamate. Many times the patients may present with a non-union of the hook of the hamate, with lack of flexion of the distal interphalangeal joints of the ring and the small finger, which represents a closed injury to the deep flexor tendons to the ring and small fingers. Vascular thrombosis can also occur, being that the ulnar artery comes around this particular area as well. And again, the patient can present with ulnar neuropathy. We see on the bottom of slide 90 the hook of the hamate fracture seen on a sagittal view. It's a fracture at the base of the hamate. It's important to pick these up, and invariably, many times, they are not seen on the initial set of x-rays. Sometimes it can be picked up on a carpal tunnel view, but many times the patient cannot dorsiflex the wrist enough to get an adequate visualization on a carpal tunnel view. So the evaluation modality of treatment of choice is a CT scan. Arc injuries. The greater arc injury is an injury which includes a fracture or dislocation of the bones that surround the lunate. The lesser arc injury is a ligamentous type of injury involving the ligaments that surround the lunate. On slide 116, the red lines evaluate the proximal carpal row as well as the distal carpal row. We want to make sure that the scaphoid lines up with the lunate as well as the triquetrum, and the distal aspect of the proximal row is collinear as well. There can be subtle injuries that, if we don't look at it in this way, those injuries can be missed. On slide 117, we describe the greater and lesser arc injuries. On the left side of the slide, we see the red lines. This is an injury that goes around the scaphoid, through the scapholunate interosseous ligament, between the capitate and the lunate, and then through the interval between the lunate and the triquetrum, a lesser arc injury. On the right slide of slide 117, we see a greater arc injury. Again, when we look at the red lines, it goes through the radial styloid, therefore transradial styloid fracture, goes through the scaphoid, transscaphoid fracture, around the lunate, and through the triquetrum. This complex injury is known as a transradial styloid, transscaphoid, transtriquetral fracture, and if it's associated with a perilunate dislocation, we mention that as well.